Ainda neste contexto, também quisemos trazer ao nosso evento alguém que sabe muito e que sabe melhor que ninguém como os sistemas de informação geográfica têm um papel crucial na antecipação, mitigação e resposta a este tipo de crises. A Este Geraghty, Chief Medical Officer and Health Solutions da ESRI, tem acompanhado o trabalho da ESRI em todo o mundo neste campo. A utilização, a adoção da plataforma ArcGIS no setor da saúde, através de um conjunto de iniciativas, mas em particular com o Covid-19, tem tido e tem sido um sucesso. Foram muitas as soluções de inteligência geográfica ESRI criadas nos mais diversos países e que têm permitido a estes e às suas organizações de saúde comunicar, monitorizar, prever e planear um eficiente combate ao Covid-19. E por isso deixo convosco o contributo muito especial da nossa colega Este, Chief Medical Officer da ESRI. Olá Este e muito obrigado.
Hola, bom dia. Roy, thank you so much for the invitation to be here today. It's such a pleasure to be able to spend this time with you talking about harnessing the power of GIS to transform health. You know, before this year, I wonder how many of you thought about all of the ways that geospatial technology can be applied in the health sector. But with COVID-19, the importance of mapped information for health has been front and center. The innovation that we've been seeing has been truly amazing. Now, some don't actually believe that you can or should innovate in a crisis. But actually, according to the Harvard Business Review, a crisis is a number of conditions that work together to support rapid and impactful change, just like what we've been seeing. One of the first things that happens is that an organization unites around a shared purpose, and that really enables a sense of courage to take action that might have actually been unthinkable during more calm times. A crisis also tends to magnify and clarify where vulnerabilities and problem areas exist, and this kind of forces us to confront our systems that may not have been working perfectly in different ways. So we see it differently and we get new ideas. The other thing that happens is that there is a lot of incentive to go very quickly, and that can help us to overcome bureaucratic red tape. And as you well know, a crisis can really create a lot of energy to just move forward. And when that energy is focused on a common goal, a lot of innovation can get done. And so I'd like to show you some evidence of the innovation that we saw early on in the crisis. And here we go. Oh my gosh. I mean, isn't that just incredible? I have to be careful because sometimes that video almost makes me want to cry. I love it. It makes me feel like I'm a part of something bigger. And so today I want to share a number of innovations organized across 4 different patterns of use that we're seeing deployed in very impactful ways to respond to COVID-19. Then I want to show you how we can apply those same patterns to other health challenges that we're facing in our communities and in our countries. If we're going to gain anything from these challenging times, it will be the lessons that we've learned and applied to make us more resilient and more responsive going forward. So let's begin with mapping and monitoring disease. Well, I'm assuming that this is a familiar sight for everyone, the world-famous Johns Hopkins University dashboard. I first came into contact with this dashboard on January 23rd of this year after seeing a tweet from the JHU team. My whole team at Esri checked it out and we were all just really impressed by its clarity of message. And I guess we weren't the only ones because the dashboard had tremendous uptake. It quickly became a backdrop in operations centers around the world, from the US Health and Human Services Secretary's Operations Center to emergency response meetings that were taking place in Germany. We saw it in coronavirus briefings in Italy. And I think you can just barely see it in the background in Ireland, among so many other places. The influence of the dashboard really broadened when respected journalists started writing about it. The coverage was extensive, but some notable examples included the New York Times, BBC World News, and actually our own Esri website used it for our landing page that was focused on providing COVID-19 resources. The story of the dashboard was featured on National Public Radio. It was in Science, Nature Index, The Wall Street Journal, and in many other publications. Actually, I was even invited to talk about the dashboard and mapping of coronavirus on CNBC News. The dashboard went viral very quickly. This graphic is showing you the first 3 months of feature requests starting from the dashboard's introduction. Now, just take a very close look at the scale on the vertical axis. Each division is actually 500 million feature requests. At a peak in late March, the dashboard was being requested 4.5 billion times per day. Now, compare that to the current world population, and you'll get a sense of how totally remarkable those numbers are. So let me take a moment to summarize some of what I think are the key outcomes from just this single JHU COVID-19 dashboard. First, it broadly demonstrated the value of GIS for health applications to a global audience. Second, the fact that the JHU team put data sharing first was a huge enabler that helped all kinds of organizations, including health organizations, to visualize, analyze, plan, and make better decisions in their COVID-19 response. Not only that, but the JHU data, by comparison, exposed gaps in our public health systems in collecting and sharing data with the public, and it exposed a lack of interoperable systems that could provide a cogent national picture. At least that was the case in the United States. Now, all of this really inspired a lot of questions about who should be an authoritative data resource in a situation like this. These kinds of questions are really critical points of discussion that I think have the potential to enhance public-private partnering and improve our capabilities in the next crisis. And finally, the JHU dashboard, because of its regular updating, built expectations among all of us for real-time and near real-time data. Sometimes we might not realize or remember it, but we never had real-time data feeds, particularly in health before. It's a completely new expectation. And I have a feeling that this is going to help push technology systems forward in very desirable ways. Now, beyond alerting the world to the developing crisis, the JHU dashboard inspired others across the globe to configure their own dashboards to map and monitor disease, like the one built by the Africa CDC, showing COVID-19 status for an entire continent, with the option to focus in on various regions across Africa. In South America, we can look at the country scale and see that Colombia is paying close attention to the origin and importation of cases. In Australia, for the state of New South Wales, the university took their analysis all the way down to the postal code. And they even had this handy filter so that we can home in on higher risk populations. In Asia, Hong Kong is sharing data on cases and hospitalizations for sure, and they're also mapping the actual buildings where there have been confirmed cases. Where I am in North America, the state of Maryland shares data at the zip code level, along with detailed information on testing volume and the percent of positive tests. As a leader in transparency, the state is also sharing this dashboard, indicating ventilator trends and current ventilator availability, as well as what I think is also a remarkable dashboard that's giving us statistical information for each and every nursing home. And of course, in Portugal, you have this beautiful dashboard example showing localized information with a breakdown by age. Dashboards are being used for more than just the raw case counts. For example, the University of the Aegean is interested in the Southern European countries, showing places where young people are at higher risk for unemployment due to the pandemic. So you can see across every continent and at every scale, even all the way to the region of Timbuktu in Mali, people have been mapping and monitoring with dashboards to understand the novel coronavirus. There are countless examples of how health organizations have been mapping and monitoring disease to give them a better handle on what their populations are experiencing. Infectious disease surveillance is perhaps the most common area of work, from mapping malaria transmission in Kenya to the presence of African swine flu in South Korea. But many are also mapping chronic disease, like cancer, diabetes, obesity, smoking and drinking, and much more. Understanding the impact of context on health is another prevalent area, like lead poisoning and low birth weight babies. And we also see more and more efforts focused on operational types of workflows, like monitoring wastewater for the presence of opioid medications, or monitoring patient flow in a hospital, as they're doing in Argentina. Mapping and monitoring disease is a great place to start for GIS in health. From there, we can dig into analysis, one of my favorite areas. It's kind of like being a disease detective. Where's the problem? Where is it changing? What are the underlying causes? How can we improve outcomes? Or how can we forecast what might be coming next? Well, in COVID-19, we wanted to start understanding gaps in services or health outcomes by figuring out who is more or less likely to be affected. Those that are more likely to be affected are considered vulnerable populations. With COVID-19, people might be vulnerable for any number of reasons, and we can visualize and analyze those. It may be that people are vulnerable because of older age or medical comorbidities that make them more susceptible to severe disease. People might be vulnerable because they're essential workers and more likely to be exposed to the virus. Or perhaps the vulnerability is because they live in congregate housing situations, like in nursing homes or university dormitories or prisons. We can overlay various vulnerabilities to find the highest risk places for COVID-19. We also used analysis to perform capacity forecasting. Now, this is where we used a model that could take into consideration hospital bed utilization data, along with social distancing behavioral data, and understand what might happen over time with local hospital bed capacity. Every hospital and every government wanted to be able to predict whether their curve would stay flat, so maintaining the health system's ability to care for each person that comes through their doors, or if some hospitals may become overwhelmed and exceed their capacity to provide care. Harris County, Texas was an organization looking at the accessibility of testing sites for COVID-19, and in their analysis, they coined a new term. Similar to the idea you may have heard of for food deserts, they detected testing deserts in their community where people didn't have good access to get tested for the virus. And this one's a little different. You can go really deep into analysis and looking at relationships using GIS. This example looks at social distancing and weather data in California. So first we can see that red areas give you an F in social distancing and blue areas will give you an A. This data comes from Unicast. And so we can see the behaviors, and we've added a layer to show the date that social distancing or stay-at-home orders went into effect in California. Well, along the coastal county was social distancing, but when you go inland, the result is just not as good. But then something else happened in late April. On April 25th, we started to notice crowds forming at the beaches. So we could do some analysis and see what was going on. To do that, we wanted to add weather data that came from NOAA. And we can look at this weather data over time using a new technique with voxels. So the darker orange, kind of brown areas that you're seeing are indicating warmer temperatures. So now let's turn to analysis where we can see very clearly visually the connection between weather and social distancing. Now, Esri headquarters is located in San Bernardino County in Redlands, California, and we'll show you that next. So here you're going to see a very clear connection between warmer weather and people kind of losing their social distancing efforts. I don't know, maybe some Esri employees decided to take a break and go to the beach. But this kind of analysis can be really impactful for figuring out what behaviors are, how to counteract those with better guidelines and measures, and really plan for resilience in our communities. Now, I could probably go on for days about how this pattern of analysis applies to health concerns outside of COVID-19. Around the world, there's a lot of effort to use mapping to better understand racial and ethnic disparities or notable vulnerabilities, like in Finland. In Lebanon, they're using mobile survey tools to better understand the lived experience in disadvantaged neighborhoods. And across Europe, there are efforts to look at civil unrest and identify and manage the pockets of unrest, especially in areas of high COVID case counts. GIS can make the complex more simple, like the risk factor map for homelessness. You know, by understanding that certain areas experience homelessness because of unemployment, while others generate homelessness because of domestic violence, helps us to put the right interventions in the right place to solve the problem. Now, I also really like the analysis of Aedes mosquito habitats around the world so that we can better plan mosquito control efforts to prevent Zika virus, dengue fever, and chikungunya, to name just a few. Now, the third repeatable pattern that we're seeing a lot of for COVID-19 is strategic planning. As I'm sure you're well aware, two staples of geographic problem solving are site selection and geographic accessibility for places. These methods have been used for things like standing up new testing sites, distributing food where it's needed, and extending healthcare services in places where hospital capacity actually does become overwhelmed. This uses location allocation. So let's say that we want to stand up new testing centers in the places I showed you in Texas that were testing deserts. For COVID-19, we would begin by determining population demand, or you might say population need for the service. We can do this by overlaying all of the factors contributing to each of the 5 COVID risk types. There's transmission risk, socioeconomic risk, susceptibility to the disease risk, exposure risk, and resource insufficiency risk. In the end, these create a risk ranking over small geographies, like neighborhoods. To calculate the best locations for testing centers, you use that risk ranking surface map along with some road network data, and then you input any constraints that you might have, like budget. Maybe you only have a budget for 10 new sites, or you have limited staff to staff the sites. The model would then select just the top 10 most from your entire population of candidates available. An important example of strategic planning that's very current right now is preparing for the efficient and equitable distribution of vaccines across each country and around the world. There are some very complex and challenging issues in this effort that GIS can nicely support, like identifying facilities that can store and administer the vaccines, determining where concentrations of high-priority populations are, exposing gaps in access to vaccine, and formulating plans to reach everyone. GIS can help manage and monitor the vaccine administration and inventory system, as well as share progress on vaccination delivery across our communities. Strategic planning in health or in any other sector is really about applying whatever limited resources we have in the most effective ways possible. Health facilities are being sited in strategic ways in Kenya, Oklahoma, and Japan. Once you have those facilities, many are focused on getting people to their healthcare appointments. And so we see planning efforts to provide public transportation and ride-sharing options. And nowadays, health organizations want to consider providing services digitally through things like telehealth or e-health options. Folks are using GIS to do that planning, to determine if there's sufficient need for those services by assessing travel burden across their populations. They're checking to see if the broadband coverage is adequate, and they're refining their service offerings by understanding the underlying population health needs. Now, the last repeatable pattern that I wanted to cover is indoor space management. With COVID-19, we know that disease transmission occurs more easily in enclosed spaces, so this topic becomes extremely important to consider. In fact, as we've seen in numerous studies, sharing indoor space is a major SARS-CoV-2 infection risk. While organizations are faced with many important decisions as reopening efforts are underway, perhaps the most important question of all is how can we health and safety inside our various buildings. A lot of organizations are paying close attention to indoor space planning in order to bring employees back to workplaces or reopen restaurants, for example. ArcGIS Indoors is being used to analyze seating arrangements and spot areas where we don't have at least 6 feet of physical distance between workstations. You're seeing those overlapping areas here in red. Once you have this information, you are well equipped to be really efficient in making proper adjustments. Inside our buildings, there's no doubt that we'll need to pay better attention to sanitization, whether we're placing new hand sanitizing stations or planning disinfection procedures for our janitorial staff. We need to be able to make service requests easily, maybe from our mobile devices, and monitor all of the progress in just one place. And we also have the opportunity to track devices in our buildings and the surrounding areas. By doing this, it becomes very easy to spot potential problem areas with high traffic or prolonged dwell times. And if an infection does arise in our buildings, we can use proximity tracking to support public health contact tracing efforts. The indoor space management pattern is the newest of the patterns I've shown you. Even so, we're seeing the concept of indoor GIS provide great value for health organizations. The effort may be as simple as visualizing an entire hospital like the BIM model from Norway. In Indonesia, they're using their building models to ensure safe evacuation in the event of an emergency. Large campuses like Harvard University or University of Toronto are making navigation very easy. Now, this same use case is critical for hospitals. I mean, if any of you have ever been in a hospital, you know what I mean. They are always confusing. Now, one of our hospital customers, Loma Linda University Health, has not only improved indoor navigation in their hospital, but they've also worked on managing patient flow through their clinics to improve efficiency and patient satisfaction. There are lots of opportunities to bring indoor GIS into the world of health. You know, I don't think we're ever going to forget our stories of isolation and quarantine, of local social distancing efforts, the hunt for toilet paper, and the creative ways that we wear face masks in public. And of course, my hope is that we never forget the valuable lessons that we've learned along the way. Like I said in the beginning, it's not uncommon to see innovation alongside a crisis. In the GIS world, this remains true. Back in 2001, 9/11 taught us a lot of integrating our information infrastructure in advance of an emergency. And Hurricane Katrina demonstrated the need for better national preparedness. The 2018 Camp Fire, which devastated portions of Paradise, California, showed us the importance of communication and coordination. As those lessons were realized, the technology evolved. We built web services to facilitate data sharing. We created story maps for more effective communication. And we now have hubs to connect and engage communities. So, how will we and future generations remember this event? Were we as prepared as we could have been? How can we better interconnect our systems at all levels and support a clear need for finer scale mapping? I hope, and actually I believe, that these lessons, among others that we learned from COVID-19, will catapult us into the next level of readiness. And you, in the audience, as GIS professionals, can assist by using your knowledge and insight to support opportunities to improve health. Because if this pandemic has taught us nothing else, we've certainly learned that we're all interconnected. Obrigado. Thank you for your attention.
Muitíssimo obrigado a todos pelo vosso contributo. É sempre muito importante ter várias perspectivas sobre um tema tão relevante para a sociedade portuguesa. Foi o caso que o Dr. Júlio Jordão e o José Alberto Carvalho nos trouxe. Mas ao mesmo tempo foi também importante poder ter connosco hoje a nossa colega Este, que partilhou experiências de como ao redor do mundo a comunidade SIG e não só estão a contribuir para o combate a esta pandemia. É algo muito importante podermos continuar a contar com estes contributos. Pois esta pandemia afetou todas as áreas das nossas vidas, desde o trabalho, ao lazer, ao envolvimento comunitário, à educação, etc. Portanto, nenhuma área do setor da sociedade ficou indiferente. Saber que os sistemas de informação geográfica desempenham um papel importante no combate ao Covid-19 motiva-nos a nós, além disso responsabiliza-nos a todos, a fazer mais e melhor com a plataforma tecnológica que temos hoje disponível para vocês.